Hi guys, so today we're going to talk about dandruff or dandruffs or dry scalp as it's commonly called in Jamaica. What a lot of us are actually talking about when we say we have dry scalp or dandruff is a medical condition called seborrheicdermatitis. Now, seborrheicdermatitis is a form of eczema and it tends to affect greasy areas of the face and body. So areas with a lot of sebaceous glands, hence the term seborrheicdermatitis, tend to be affected. This includes the scalp, the central parts of the face like around the nose, around the brows, around the mouth. The chest and back may be affected, and even under the armpits and the groin are sometimes affected. Alright, so of course you want to know what causes seborrheicdermatitis. Well, it's a little bit complex, right? So scientists and, doctors think that the yeast on the scalp, it lives naturally on everyone's scalp, malassezia. It tends to interact with lipids or oils on the scalp and on the affected areas, and this interaction sometimes triggers off an inflammatory cascade that results in redness, itching, sometimes even a little bit of swelling of the area, not commonly, and other sensations that are unfavorable, and with that persons develop scaling of the skin as well. Right, so as I mentioned, the areas that are affected are areas that have a lot of sebaceous glands or oil glands, and in these areas on the face we tend to see sometimes paler areas, so pale patches. They may be a little bit red underneath, sometimes they're not red at all, and they may have mild flaking to more moderate and severe flaking. So in someone who is dark skinned, this may sometimes look like vitiligo or another condition, so it's easily confused sometimes with other pigmentary conditions, right? And we have to know what to expect and in what locations in order to make the correct diagnosis. Now on the scalp, the condition can range from mild scaling and irritation to very thick scales that are very itchy with redness in the background, and persons complain of severe itching, and when they scratch the area sometimes they become sore, and a lot of the times persons develop a bacterial infection as well. When they scratch and break the skin, then bacteria just jumps right in. So sometimes you can have a secondary bacterial infection. Another thing that can happen with the scalp is that after having this condition for a long time with the constant irritation and inflammation of the root of the hair follicles, then some persons will experience hair loss and hair breakage over time. This isn't usually an early finding. This tends to happen in persons who've had the condition for a while without it being adequately treated. So on the body areas, commonly the chest and back, in the upper parts of the chest and back, we tend to see different patterns. So it can be like what we call a petaloid pattern. That's almost like petals coming together. So a very circular looking rash that can be pale, it can be dark, and usually similar to the face, you'll see mild scaling and maybe a little bit of redness, but the scaling and redness isn't always present, especially if the person has been using something to treat the area. Some factors that worsen seborrheic dermatitis include stress, a history of oily skin, a family history of seborrheic dermatitis. If in persons who have psychiatric disorders, we tend to see it a lot more, and in persons who are immunosuppressed, such as diabetes, HIV, or on certain immunosuppressive medications that don't allow the immune system to really do its job very effectively, they can also develop a worse form of seborrheic dermatitis. In the treatment of seborrheic dermatitis, we tend to use a combination approach. So we address the yeast that's on the scalp, we address inflammation and the itching, but we also address the excess scaling. So we try to lift the scales, and this will help our products to penetrate even better. So ingredients like salicylic acid will definitely help to get rid of that excess dead skin cell buildup on the scalp. It's called a keratolytic. Other helpful ingredients to look out for are zinc, pyrithione, and selenium sulfide. In moderate to severe cases, we may also need to add oral antifungals to really help to get the situation under control. There are other treatments that can be used, however, these are prescription only and your dermatologist will certainly discuss them with you. I know that a lot of us with black hair, we don't always find it easy to wash our hair every week, but it's actually advised that just to help with the burden of the yeast on the scalp, to wash your hair at least once a week with a medicated shampoo, lather it up on the scalp, not on the shaft of the hair, but really focus it on the scalp, and then leave it on for about 8 minutes to 10 minutes, then rinse. Now, medicated shampoos tend to leave the hair a little bit dry and coarse. It can become brittle and actually break off, so I always recommend that persons use a deep conditioner treatment afterwards, and always ensure to moisturize and seal the hair shaft. So we don't want to be treating seborrheic dermatitis and end up with hair breakage because of the treatment that is recommended. If you believe you have seborrheic dermatitis and it's not under control, you've tried over-the-counter products and you're not getting better, don't sit at home with it. Please definitely seek the help of a dermatologist, because if it's not treated properly, you can have long-lasting effects. If you want a rundown of what we've spoken about today, seborrheic dermatitis, there is a blog post on my website, skintempledermatology.com. Check it out for additional information. Please remember that not every itchy, red, scaly scalp is seborrheic dermatitis, and in order to get a correct diagnosis and the correct treatment, you need to see a dermatologist. Thank you for watching this video. If you have any questions, leave them in the comments below. And if you have a private question, you can send me a DM on Instagram. Don't forget to like, share, and subscribe, and I'll see you next time.